Hi, my name is Nicole, and I'm talking about the complementary integrated alternative medicine. At the end of this presentation, the learner will be able to differentiate between complementary, integrated, and alternative medicine. The learner will also be able to name three main reasons on what influence CHEM has on nursing practice. And he will be able, or she will be able, to name what major impact CHEM has on healthcare and the society. What is complementary integrated alternative medicine? Complementary medicine is the mainstream practice used together with conventional medicine, where alternative medicine is mainstream practice used in place of the conventional medicine. And integrated healthcare brings complementary and alternative medicine together. It emphasizes a holistic, patient-focused approach to healthcare and wellness. It aims for well-coordinated care between different providers and institutions. On the next few slides, we're seeing influence of CHEM on the nursing practice. One of the biggest concerns are the safety concerns, which intercultural exchanges and CHEM use increased worldwide. New products appear and healthcare providers are not able to educate the community properly, is one of the big safety concerns we have, and limited research on use of herbs and dietary supplements. Then we have the nursing considerations, where knowledge about our patients' med intake is a big point, knowing their herbal supplementations, also knowing their knowledge about their health issues, and how to properly educate our patients on CHEM. Caring for special population like the older adults who are taking combined prescription and non-prescriptions, that can be a major risk for drug interactions. And pregnant patients, there can be some interactions if they use different herbs, which has not been studied very well. In one of the studies, I found that the majority of healthcare providers do believe in the future of integrative medicine, but their knowledge among healthcare providers is still low, but the engagement is higher. And they're still reluctant to recommend CHEM, but believe in the future of CHEM. On this slide, we see that double the percentage of nurses see conventional medicine and CHEM at the patient's discretion, but only 3.5% of nurses see a conventional medicine by itself in the future. On the lower part, we see the percentage of healthcare providers who are asked patients about CHEM usage and who would recommend the use of CHEM. Here we see what impact CHEM has on healthcare. Most common CHEM therapies among the adults is on first natural products, followed by deep breathing and meditation. The integration of CHEM within the mainstream health services can help the patients with psychological traumas and also chronic diseases. The biggest thing is it treats not just one part of our body, it treats the whole person, and it increases the healthcare choices for the patient. Health insurances are now covering more likely for chiropractors. There's also an increased activities in the population over the years, especially in meditation, and you have an overall healthier lifestyle. There were some researchers I found who showed a significant difference between CHEM and non-CHEM users for the quality of life. CHEM users were found to have a higher financial burden, which could have led to more stress. And patients are encouraged to discuss the use of CHEM and weigh the pros and cons before starting it with their healthcare providers. Another study showed a significant positive outcome in major cardiac indicators when they were associated with increased use of CHEM. Now, furthermore, they showed a positive association between religiosity and CHEM use. And this is the end of my presentation. What I talked about was the difference between complementary, integrated, and alternative medicine and how it is integrated within the mainstream medicine. I also talked about the impact of chem on our healthcare and our society. Now, the takeaway from this is I want you to ask yourself, is chem in conjunction with traditional medicine better, or do you think it would be better by itself? What I believe is we do need more education on chem, so also the physicians feel more comfortable to recommend it, and we are able to educate our patients better on it. Thank you very much for watching.